In 2007, Baptist Health experienced a rather unique and disturbing situation where we saw a more than 50% increase in uncompensated care year over year. And we weren't sure exactly what was driving that. It was early in what was going on in our country in terms of the growing numbers of people without health insurance. And so we decided to dig deeper into the data and see if we could understand the situation better. And what we found was that 80% of the costs were being driven by 20% of our population. And those folks had one of the 5 major chronic illnesses. And as we began to explore more in the data, we realized that not only did they not have insurance, obviously, but they also didn't have a medical home. And as we spoke with physicians in the emergency room and in our residency programs, we began to understand that there were concerns that when they were discharged from the hospital that they may not fill their medications, or that they frequently would not return for an appointment, maybe because they couldn't afford it, or possibly because they didn't have transportation, or they weren't able to leave their workplace. So that search for data and for understanding led to us creating the program called CareAdvisor. And CareAdvisor is, I like to think of it as a 3-legged stool. And one of the legs is a medical home. And the second leg is providing medications that are needed to manage their illness. And the third is care management, which is in our program provided by both nurses and social workers. And we believe when you create that 3-legged stool, that ultimately you can get better health outcomes for these individuals. They're able to manage their disease better, and we're able to reduce costs overall and be able to keep them out of the hospital. And ultimately that's what our goal is. We have had a significant impact by implementing the CareAdvisor program. If we look at the 200 patients that we're managing today in CareAdvisor, where we provide them with a medical home, they have a physician that they can see regularly. We provide them with the medication that they need to manage their care. And then they have a nurse that's always available by phone, or that will go to the doctor's appointments with them. We'll check in on them to make sure that they're doing okay, they're managing their illness okay. If you look at that 200 patients and you go back to the 2 years that we looked at them in terms of how they utilized our services in and outpatient, and then we look at them now, we have dramatically decreased the admissions and readmissions. We've been able to keep them out of the hospital. We've been able to effectively reduce the overall costs of their care. In many situations, we've had people that have been able to return to work, that have been able to experience a normal family situation and enjoy grandchildren. So there's all sorts of benefits that we've seen. CareAdvisor has definitely helped to change lives. I think we've improved the quality of life that they experience, but from a community standpoint, we are improving health outcomes. And in that process, we're reducing costs. We're ensuring that, that those in our community that need health care are receiving health care at the right time, in the right place, and in the way that they need it. And when you look at what's going on with healthcare reform in our country, I think that Baptist Health has done a phenomenal job of figuring out how to manage a situation both now and for the future, whether or not we're being given the resources to do it. And I think that's unique, and I think it's something that needs to continue, and I think that others across the country can learn from our experience.